Corporation Hospital, Toledo City, Cebu. He is also the president of PSMSG, Cebu Central Visayas Chapter, general surgery consultant, of course, a Riway Diamond one-star, and whose wife is also a pediatrician. So ladies and gentlemen, let us put our digital applause to our first speaker, who will do the product presentation in the name of Dr. Fadz Taalim.
So good afternoon, and of course, I'd like to greet our brother and sister in Islam, Eid Mubarak, because today is the celebration of Eid Mubarak. And this is actually my first time to lecture online, like this. I'm usually lecturing is face-to-face, of course, with the student, with other co-doctors. So to make this very simple, this is actually my slide. If we talk about stem cell, we can even spend a day or more. That's very vast topics. But we will make it very brief and short. So we all know, we have already actually see in the news, in the papers, or even in the social media about stem cells. Stem cells have been talking all around the world. What is stem cells? What is this? What's the benefits of the stem cells? But unfortunately, in medical school, we only talk a little of stem cell. Okay? Maybe we forgot about what is really about stem cells. We only talk about this when we touch of the embryology of human being. So, history of stem cells. I just cut this short because there are so many vast history of stem cell. So even before the time of ancient civilizations, stem cells has been there, but they don't know what is it. They even eat raw bone marrow. They even eat raw materials, tissues to heal themselves. And actually, that is a stem cell. So only in 1908, the term stem cell was coined by Alexander Maximov. And, still the number one researcher or the number one using or researching about stem cell, about the benefits of stem cell is this United States of America. But in 2001, President Bush restricted the funding. Why? Because they used embryonic stem cells. So when we talk of embryo, meaning it's fertilized, fertilized egg, human egg cell fertilized with the sperm. And it become, when we use embryonic stem cell, it's the effect of that is, of course, it will be abortion. So most of the countries, especially Roman Catholic country, prohibit using the embryonic stem cells. That's why they restrict the funding until President Barack Obama came. He will go back with the research on stem cell, but in the premise, not using an embryonic stem cells or the actual embryo. So they try to find other ways, embryonic using studies. There are a lot. Even you yourself, you can actually browse it on the internet. And as I assure you, there is no negative about stem cells. Most of the time, if you research on the stem cells, it's the positive effect of the stem cells in human, in treatment and in cure. So this is just some. There are a lot of studies in the internet. There are a lot of studies on the internet. So what is really a stem cell? We call it, what is stem cell? So if we talk of stem cell, it just starts from a single cell, from a sperm cell and the egg cell of a mother. When it fertilizes, they become, we call it zygote. That zygote is actually a stem cell. So from one cell, it becomes 2, 3, become morula, become blastocyst, until it become tissues, organ, until it become human being. So it's where we started. No, human being actually is composed of around 37.2 trillion cells in average. Okay? But we also lose 100 millions per second of cells. So if it's not been replaced by the stem cell, people will not live even a day. No, remember, millions or 100 millions of cells per second. We lose that every day. Okay, so because of the stem cells, human being live. So stem cells, they are actually non-specialized cells. They are not yet committed, meaning they are not yet committed to become a specialized cells, to become like a kidney cells is a specialized cells, heart cells, brain cells, bone cells, connective tissue, everybody is actually specialized cells. So stem cells, if they are not needed, meaning they are not needed for protection, repair, and of course rejuvenate, renewal of a new cells, they will replicate, copying themselves so many to reserve it if in case a specialized cells needed, for repair. Like for example, a patient with a kidney problem. So this stem cell, they go into the kidney to become a specialized kidney cells. So that's how the stem cells work. So actually, we have a lot of tissue stem cells in our body. No, this is just some. We can find it in the surface of our eyes, in our brain, skin, breast, intestine, testicles, muscles, bone marrow, and according to Dr. Neil Jordan, this is one of the leading scientists also of the stem cells in the Panama Institute of Stem Cells. It can be also found in even in the teeth, placenta. Of course, placenta, there are a lot of stem cells in the placenta, and even in menstrual blood of women. Okay? In every organ, we have our own stem cells. So why they do research? Why we will need to do research on stem cells? Because of these 10 top 10 killers. This is according to WHO in 2018. I think there's no yet update on this in 2020, but in 2018, these are the top 10 killers. No, the heart disease, the stroke, Alzheimer, lung cancer, chronic obstructive pulmonary disease, lower respiratory tract infection, colon cancer, diabetes, kidney disease, and breast cancer. Yeah, just go this briefly. So heart disease, usually heart attack in common and layman's term, heart attack. So what happened actually is a plaque or obstructions. Usually there is an injury to the wall, injury to the wall of the coronary artery, a supply, blood supply to the heart itself. So what happened if it is blocked? No, there will be necrosis. There will be infarction, meaning dead tissues of the heart. So that's where the heart attack. Okay? I mean, so what can a stem cells do? No, hematopoietic stem cells or mesenchymal stem cells can actually repair the wall. Okay? The injury, it become like this again. So the blood supply to the heart will be back to normal. And what about those dead tissues in the heart? Because the dead tissues in the heart, no, based on the study now, latest study on the heart, using stem cells, they can be repaired. They can be go back to normal muscles or the normal cells of the heart again. So the heart will function normally. How about the stroke? This is also number 2. Even in before, no, the stroke still number 2. So stroke, it can be caused by uncontrolled hypertension. So if it is increasing, abnormal increase in hypertension, what happened to especially the vessels of the brain, it will rupture. And there it will be now bleeding. That can cause compression to the brain. So another cause is also obstruction. Okay, the blood supply will be obstructed. This part of the brain, that blood supply was obstructed, it become now infarct, or meaning dead. As we know, brain cells cannot be regenerated. Okay, nervous system, brains, especially nerves, cannot be regenerated. That's according to science, but not until the advent of stem cells. I saw stroke patients recovered completely. No, this is my own experience, my own patients with the stem cell. Okay, so I find it very, very amazing. So miraculously, they can recover, meaning recovered, full recovery, not just a partial recovery. So Alzheimer is number 3. In 2015, Alzheimer is only number 7. Okay? Alzheimer that cause dementia, cause memory loss. Usually elderly, 65 and up, 60, 65. Especially if we have hereditary family history of Alzheimer or dementia. What happened is the neurons, the cells of the brain is dead, as goes with aging. especially those with alcoholic brain, meaning alcoholic patients have smaller brain compared to non-alcoholic patients. So these neurons will die, along with it our memory that will cause now dementia. So now, how come it can kill? No, when we lost our memory, how come it can kill? Most of the time due to accident. Most of the time due to overdosing their maintenance medication. Then they tend to forget. They already took it, and then after 15 minutes, they took another. So what happened is overdose, side effect, and even accident. Okay? I have one friend, mother of a friend of a doctor. Okay? It's almost burned their kitchen. Why? They forgot her mother forgot to turn off the gas stove. No, it's almost burned all the houses. So maybe the burden with it, with the Alzheimer, that can kill a patient. Lung cancer. Lung cancer is not only for those smokers. No, even young. I see 38, 47 years old male patient that work in the factory, that work in those chemical factory that expose them usually to asbestos. Okay, it can cause lung cancer, small cell carcinoma, and most of the time, no, is stage 4. But with the advent of stem cell, they can benefit and then can benefit from it, even relieve some of their symptoms. But those late stage, we cannot also do anything, but it can still prolong. Okay, so if you have a lung cancer patients, usually maximum 6 months, they will really die with or without treatment. But so most of their patients I handled using the stem cell, they even increase their life even 2 years. Okay? So chronic pulmonary obstructive disease, or the COPD, okay, it's number 5. So if we talk of COPD, this is usually due to chronic smoker. So those who smoke, what happened? Nicotine will destroy the normal alveoli. This is the small unit, okay, functional unit of the lungs, that where the oxygen and carbon dioxide exchange will occur. What happened if it is destroyed by the nicotine, when they're smoking? There's no exchange. Now, even nowadays, there's no actually treatment or cure for COPD. It's just symptomatic. It will just relieve. It will just relieve the symptoms, but eventually the patient will die. But with the stem cells, because it's repair, okay, it will repair the alveoli. So there's a tendency there will be exchange, normal exchange of carbon dioxide and oxygen back again. So number 6 is the lower respiratory tract infection, particularly the pneumonia. Why it is? Because of our immune system. If we have low immune system, what happens? It can be easily touched, pneumonia, by this opportunistic bacteria and even viruses. Even nowadays, COVID-19, mostly patients will die of pneumonia, severe acute respiratory illness or infection. So stem cell, one of the function of stem cell, it can boost immune system of the body. So it will protect. So how about colon cancer or colon carcinoma? Okay, so the colon cancer, the youngest I operated is 14 years old. Very, very young. It's due to diet. More on fast food, less water, less fiber. So what happened? They only defecate once a week, twice a week. Remember, those fecal materials is toxic. It's toxin, chemical with it. We need to excrete it from our body. What happened if the colon is exposed to those toxins? It will irritate the wall, and the response of our cells is to produce a lot of cells. That's actually a tumor cells. Not actually a cancer. Until some of it becomes stage 4, extend to other part of the body. So in stem cells, because of its characteristic cell apoptosis, meaning cell death to the cancerous patient, to the cancerous cells, it can really help benefits from the stem cell therapy. Okay. So number 8, diabetes, DM. Even with 1,000 participants, maybe worldwide, in our seminar now online, based on study, 50%, most of it, 50% in a room of 100 people, 50% of them or 50 of them are actually diabetic. Okay? That's how rampant is diabetic. That's how we call it sikat, no? Become very, very rampant and diabetic. 50% is actually diabetic in 100 group of people. And most of the time, they don't know they are diabetic because they don't yet take a laboratory to take the sugar, how's the level of their blood sugar. And this is especially the type 2 diabetic. So what happened in diabetes because of this insulin? No, insulin will be produced in the beta cells of the pancreas. So when the pancreas beta cells stop producing insulin, our blood glucose, it will stay in the actually blood, no? That can cause different side effect on our body. What is the main purpose of this glucose? It must enter the cell via the key of insulin. They will be used as an energy for our cell. Okay, that's the main purpose of it. So kidney, of course, kidney problem, kidney disease, even as young as 24 years old in female, we have acute kidney disease because of the dehydration, because of diet. There are a lot of cause, toxin, less fluid, less water. When we talk of fluid, it must be water. No? It's still applicable, the 8 glass of water, but the 8 glass, the 1 glass is not delicious, it's not 200 ml, it's 330 ml. Okay? So around 2.5 to 3 liters a day must be taken to make our kidney healthy. As I said, there is property of the stem cell in relieving or in replicating or in repairing protections of the kidney cells. They will go there and repair as long as the kidney is still functional, meaning at least there's still at least 1%. Because if the kidney also is dead, non-functional kidney is useless for the stem cells in there. One of the function of stem cell is to stimulate the normal specialized cells of the organ to replicate more. So if there's none left, then it's useless also. So number 10 is the breast. Breast cancer. Usually in the Philippines, we will patients come to our clinic, we capture like this. This is already advanced stage. This is stage 4 breast cancer. Even though, even stage 4, what more if it is lower, stage 3, they can benefit from the stem cells because of its characteristics, cell apoptosis, cell death to the cancer cells. So what causing all of this? Because of this free radical. This is very simple. If patients or people very, very stressful, our body, our mechanism tend to produce a lot of energy. And the byproduct is free radicals. I think you heard about this free radical. So what is this free radical? It's actually an atom molecule unstable because there is no unpaired electron. So what happened? They will get electron from our cell. So what happened? All the electron, they get it from there, and the cell will become dead due to oxidative stress. We call this process as oxidation process. I think you are a lot familiar with this, antioxidant. But there are a lot in the market. Okay, drink this, talk this is antioxidant. What's really antioxidant? Antioxidant actually is an element or any product that has extra electron that can give it into the free radicals to make it stable to stop from getting the paired electron from the cell. So the cell will become now healthy again. And one of the characteristics of stem cells and this product has antioxidant property. So the stem cell function, if you can see on the table, it will give us protection, repair, regeneration. But if you look at the protection and repair, there are a lot in the market, even in the nature, we can use it to gain protection and repair of our cells. The only thing they can do is regeneration. Only live stem cell therapy can do that. So this is according to Dr. Neil Jordan. Before, the old paradigm is cell replacement. We all know stem cell will go to kidney cell to replace kidney cells. Go into the brain cell to replace brain cells. But actually, based on their latest study, this is last year, May 2019, it's actually secret something or it's replaced. For example, our kidney cells is going to die because the mitochondria, part of the cells is dying. Stem cell will donate its part, no? Stem cell will repair and donate its part. So those specialized cells, they become new, renewed, rejuvenate, okay, again. So that's how it works. No, it's not actually replacing. It's not actually replacement. So these are the potential before in 2010, no, before 2010, they call this is just a um, potential use, no, benefited from stem cell therapy. But 2010 and beyond, studies help party stem cell therapy can benefit and even treat and even cure. Now, there's difference between treatment and cure. Cure meaning there's no evidence of disease anymore after the treatment. Treatment, it can just control, okay, like maintenance medications treatment. And mind you, all pharmaceutical company, no, when they make drugs, when they make medicine, the aim is must go inside the cell to make the cell healthy. Once the cell healthy, tissues healthy, organ healthy, system, whole body become healthy. Whole body become the treatment, become the cured. But if it not going, no, if you have product will not enter the cell, is useless. Just example, into the surgeon, this is injections to the knee, like steroid injection, even lubrication, gel injections, it just lasts 4 months to 6 months because it will just give you the pain relief, but not actually curing what happened. So due to wear and tear, okay, this articular process will become destroyed, and bone to bone now is actually rounding to each other. That's very, very painful. So with stem cell, this articular process, cartilage will become remodeled, they will become, okay, renewed. So they will actually remove the pain permanently. So how we can get this stem cell? No? We're talking about a stem cell therapy. Where can we get this? Okay, how to avail this? So this is the method of receiving benefits from the stem cell. Okay, today we have the placental injection, still stem cell injection in Switzerland. Okay, you need to go to Switzerland, especially in the clinic of Paul Hans. Okay? So you need to spend around 50 to 100,000 US dollars. So rough estimates around 2.5 to 5 million pesos. Okay? It's only a injection and it is targeted, meaning it's not the whole body system. If you're complaining of only the knee, they only target the knee. If you only problems the heart, only target the heart. So that's how the injection of the placental injections, no, of the stem cells. Stem cell transplant. This is also high risk. We need to be admitted, patients need to be admitted, and we need to get adipose tissues or bone marrow from you, and we will inject it back. Here in Cebu, we have that before, but the clinic or the hospital offering that is closed because it's too expensive. You need to spend 800,000 to 1.2 million per injection, plus the risk of anesthetic and, of course, the side effect of infection from the wound, no, from the surgical wound. And this called blood banking. This is now actually trending. No? Mother give birth, the umbilical cord of the baby will be stored to a bank. Okay? Why? Because that code is rich in stem cell. But you need to pay annually. As far as I know, it's 300 to 400,000 pesos annually. And it will only last 20 years, 21 years. Okay? 21 years. And remember, based on study, our cells can still have a lot of active stem cell until 25 years, okay, 25 years old. So, cold blood banking is only up to 21 years. So, it's hard. If you're still healthy, it's just useless. You just spend money that much, okay, for nothing. miss the chance, no, that limit. So another is we have very cheap, okay? Those in the fly-by-night beauty parlor, they offer injection of the placental injection, and they said they get it from a human placenta. It's more dangerous. Why? We don't know that human placenta has HIV. Okay? We don't know has hepatitis. And they are not professional to do it. So it just adds a lot of complications on that, although it's very, very cheap. How about adult stem cell? Adult stem cell is very, very hard to harvest. That's why it's very, very expensive. And how about free, doc? Is there free? How to become healthy? Yes, of course. Healthy lifestyle. No, you can jog every day. Okay, eat a right food every day, vegetables. Okay, enough exercise, enough sleep. But who can do this every day? No, healthy lifestyle, especially if you are working. No, if you are very, very busy with our work, we cannot do it. So, is there any convenient, effective, and affordable way? Of course, there is. Okay? This product, live stem cell therapy, PURTIER placenta, and it's in its 6th edition. So it keeps upgrading and upgrading. So live stem cell therapy in a capsule form. How come, Doc, it's in a capsule form? Well, any capsule, when you cut it, it's powder. Okay? I tried this. I cut the one capsule of the PURTIER placenta. It's actually liquid. And look at it under the microscope. It's live cell in it. So why we need live? No, that's the questions. Okay. For the stem cell to be effective as a treatment or as a therapy, it must be live. It's just like blood transfusion. No, red blood cell must be live. So if we have patients, the doctor said, we need to transfuse blood to your relatives, to your patients. So I need fresh whole blood or packed RBC. So it must be fresh, meaning the cell there, red blood cell must be live. So the same thing with stem cell. It must be live entering our body to make it very, very effective and beneficial for us. So if there's in the market telling you, buy this, this is a stem cell, no, this is a placenta soap with stem cell. Okay, how come it become effective? It is a soap, so it must be going heating process to make a soap. So it's useless. Or maybe drink this. This is a juice from become a stem cell with it. So all those process undergoing heating process, it's useless, it's not effective. So it must be live entering our body. Not only stem cell in this product, there are a lot of organic, okay, organic component, and it is very, very familiar with us. They are very, very effective. Okay, look at the apple. This is in the 6th edition. They add apple polyphenol. Okay? This is equivalent 100 apple in one capsule. No, we have saying an apple a day keep the doctors away. This is 100 apple, meaning keep the 100 doctors away from you. Keep the medical center away from you. Keep the hospital away from you. So that's make you healthy. This is only one component of it. They have dendrobium. There are a lot of it. And most of the time are the one with super antioxidant property. Okay? So why placenta? Why deer? Look at the deer. Almost all part of the deer are made into medicine. They are used as medicine. And even the pistol, this is the penis of the deer. So it's become medicine. Look at the placenta. Look at it. It's almost the same as human placenta. Those doctors now are listening to us now, nurses or even a midwife, letting you see actual placenta. It's almost 99% the same chemical composition and even physical property of it, the same with human being. So this is our source. It's rich in a lot of stem cell, no, in this deer placenta. It is from New Zealand. One of our sources from New Zealand. There are more deers than human in New Zealand. There are, I think, 15 million on human. Their population is only 4 million. So, and it's a zero pollution country, so we can assure of the quality. And they will not kill the deer, okay, just to get the placenta. They wait until it deliver the baby, you know, of the deer, the dog, okay, or the female deer. And they get it and they will process it. They have unique processing. So look at the placenta. I included this is the breed of life, purpose of the placenta, nutrients. supply growing fetus. This is, we call this peto-maternal, no? Peto-maternal organ. This is the only connection between the mother and the child, no, inside. Enriched in RNA, DNA, and even glutathione. Huh? Glutathione actually is not used for making our skin very nice looking, white. This is actually one of the greatest antioxidant in the body. We can produce our own glutathione. We don't need injection. So it is included in this, no, in this product. Hyaluronic acid. Look at those beautification product, no, for beauty, skin beautifying product. They have always have hyaluronic acid, which actually give natural moisturizing factor to the skin. Okay? So the technology they use is actually manufactured in New Zealand in Alpha Lab. They have this freeze drying technology. Using the freeze drying technology, once the placenta is harvested, they will freeze dry and harvest the stem cell, and it will last 3 to 4 years. So how about those medications in the market? They will expire in just 2 years. Okay? So this 3 to 4 years. And the common capsule in the market, they use actually oxygen. So oxygen can cause oxidation, can cause oxidative stress, and can actually grow microbes inside it. That's why it will not last long. And this product, they use nitrogen. Nitrogen, really, viruses or other organism, living organism, cannot thrive on a nitrogen environment. But it will not harm the content of our capsule. So they use this. And of course, every time you take medicine, it will pass through the mouth, pass into the esophagus, into our stomach. In the stomach, there are a lot of acids. So what happened to our medications there? If you took like paracetamol, 80% will be destroyed on the acid environment. Only 20% will go into the small intestine. It's where it is being absorbed into the body, in the small intestine. This is an alkali environment. So if it is not protected here along in the stomach, it will become destroyed. It's useless. But PURTIER placenta is actually enterocoated. It's protected from the acid, and it will pass through into the small intestine, absorb in the small intestine because of its alkaline environment. And if you ask me, is after in the small intestine, where it goes, most of the time, all the medication will go to the liver. We call it the first pass effect. Okay? And in the liver, 80% again will be destroyed. So what happened if this PURTIER placenta will go into the liver? Only 20% will go inside our body. So how come it's almost 100% will go into the site of the disease directly and go into the liver, but it will go into the lymph vessels. Now we call it lymph vessels. So lymph, they have another access going into the thoracic duct, into the subclavian vein on the left, and into the heart directly. So that's why it can distribute directly. And because of the emulsification technology plus the nanotechnology they use, it's very, very small, no need for energy, no need for receptor in the cell that can use it to enter. It can actually enter directly into the cell, no, due to this technology. So it can really absorb without passing to the liver, without passing the first pass effect. And then in the 6th edition, they add this biosoftgel technology. It can it multiply the absorptions of the product, easily absorb, easily go inside our body by this biosoftgel technology. So this is just showing you the evolution. As I said, it's already upgraded to the 6th edition. So from the first, look at the content, no? From the borage oil to the aloe vera to the shark oil or the to the avocado. Okay? And then the second, they add the evening primrose oil into the collagen. Okay, this is peptide collagen. And on the third, they add xanthan. On the fourth, they add the lycopene. And on the fifth, they add the dendrobium. And on the sixth, I said they add the other component. Okay? So why do we need supplement? Okay? So before we tackle this, our system is actually a tripod, meaning 3 foundations. one of its treatment, like conventional treatment if you have disease. Another is lifestyle, lifestyle like and supplement or jogging. Another is supplement. This one is one of the tripod of health. So if we talk supplement, no, we consider this as supplement. But actually, based on my experience, it's not just supplement. It's actually treatment. It's actually cure for other diseases. So supplement. If we talk of supplement, meaning our body cannot create everything we need. Okay? We cannot create, we cannot produce what our cells need, and not all. So it needs an external supplement. So this is supplement and prevention. It can prevent us from getting very ill and fast recovery, and it lower the three highs. What is this three high? Okay, one is the sugar, blood sugar. One is the cholesterol, and the other is our blood pressure. And it can give us protection, repair of the cell, and detoxify. Okay? Look at these 7. There are a lot also product in the market can do this. No? But the only thing they can do is regenerate, meaning renewal, rejuvenate of a new cells into a young, healthy cells again. This is the only product, no, stem cell, particularly the PURTIER placenta. If we talk of the safety certificate, it's internationally accepted, and even it's halal, no, halal certificate, no, for our brother in Islam or Muslim brother, it's actually halal, and it's award winning, no, on the highest standard of reward or awards. In the Philippines, we have our own, but it's, as I said, it's actually supplement, no, under supplement. So how to take PURTIER placenta? This is the basic. It's actually 6 months. Why 6 months? Based on the study, even injection stem cell, even implant stem cell, it took 3 to 6 months for it to become very effective, for it to become very beneficial. So first, second, third, until 6 months. So in the first month, 2 capsules in the morning, 2 capsules in the evening or in the afternoon. And the rest, only one capsule in the morning, 1 capsule. Look how come it is to cell stop being active and it become dormant when we reach 26 years old and up. So if we took this, we need a lot of dose. We call it a loading dose for it to stimulate those remaining stem cells in our body to work again. And then the remaining 2 months, from second to 6 months, is just a maintenance phase. But this is also adjustable, depend on the case. If the severe case, and then we need to increase or to decrease. But the standard dosing is like this, no? First until 6 months. Okay, this is I think my last slide. Okay, why do we need to put this slide? Okay, this is actually the source is I got this from the slide of Dr. Leo. No? This is the World Medical Association. Helsinki Declaration in 2013 state that in the treatment of patients where proven intervention do not exist or other known intervention have been ineffective, the physician, after seeking expert advice, with informed consent from the patient or legally authorized representative, may use an unproven intervention in the physician judgment. It offers hope of saving lives, restore health, relieve suffering. They said here, no, may use unproven. Stem cell is not unproven product. Okay? Stem cell is proven by so many studies. So why not using this? Give this another alternative for our patients, for our relatives, especially those who lose hope with a conventional, or we can go hand in hand with conventional treatment at the same time with this stem cell. So I have a lot of patients undergoing chemotherapy at the same time using stem cell. But I noticed in 5 of my patients, they don't have side effect of the stem cell. They don't have the side effect of the chemotherapy. Okay, I think that's the. I hope you get some knowledge on this. I hope it's not too fast. As I said, if we talk of stem cell, we cannot finish this in just 30 minutes or no. This is just a brief general info I hope you can understand my also slide, and I hope there's no technical problem. Thank you. Good afternoon.